Hi, I'm Dr. Elizabeth Coyne, and I'm going to present Module 1 for Managing Complex Clients. So this module is all about patient deterioration, looking at the factors, how to assess them, and the different response systems that we've developed in our hospitals. Remember, always go back to the learning objectives for the course. Have a look at them, refresh your memory, think about the assignment. So as you're reading this information in Module 1, you're developing your own skills for practice, but also for the assessment items. So what do you already understand? We know that in different times in a patient's trajectory, there is higher risk of deterioration. There's different signs that we look at. So think about different patients that you might have cared for that had deterioration. What was their main presenting problem, and what was the comorbidities, and what were the things that really changed. The assessments, again, are really way to look at what is changing, how fast, and what we need to do about it. The factors, we're going to use the clinical decision-making cycle, but there are other ways to look at deterioration as well. The main thing is to be aware of the different aspects, staffing, communication, and organisational factors which influence how this patient assessment, the deterioration, and how you actually get a response. Other factors as well, family. So, the sort of previous understanding, how much they shared about the patient, but also their own ability to escalate care. The patient factors, comorbidities, situational awareness, picking up on those small signs before they become major problems with deterioration. Timing, really key times. Lunchtime, handover, and transitional periods. So this movement of patient and changeover of care are really key aspects where patients can deteriorate and it's not picked up quickly. The actual response rate and how we sort of respond and our assessments and what that means, and also the policy and the frameworks that we use to assess these patients. So in summary, Module 1 is all looking at that patient deterioration, the assessment, the factors, the frameworks, and really strong linked to your assessment 1. So have a think about sort of what I need to do as I'm reading through this module, how I have that into my own clinical practice, but how to then make sure that's supporting my assessment 1. Thank you.